Hey everybody, this is Brian. Happy Memorial Day weekend. Hope everybody's had a great week. I know it's been pretty rainy here in Ohio, but hopefully finding some opportunities to get out and move, get some exercise, even do an inside home workout, whatever you need to do to keep moving. And we're excited for this week's virtual Walk with the Doc series. Dr. Mohammed is our superstar family medicine physician in the Dallas area, and she has some great info to share with us, so make sure you watch and then get out for a walk afterwards and let us know about it, either in the Walk with the Doc Facebook group or just head to our website and send us a quick email. We would love to celebrate with you. So Dr. Mohammed, take it away.
Hi everyone, my name is Dr. Mohammed and I am in Dallas, Texas. Just wanted to talk today a little bit more about mental health as we're going through this COVID-19 pandemic. Just a couple things from the CDC website that I thought would be really beneficial for everyone to hear as reminders, or maybe this is new information that could be beneficial for you and your family. In general, outbreaks are very stressful, and a lot of us have never even experienced something to this caliber. And so with that comes a lot of different aspects of fear and anxiety, and especially with how much information is being covered in the news media these days, it can be very overwhelming to constantly get the bombardment of the information on a daily basis. So it's important to strategize boundaries regarding that, because news content is very important. You should be up to date with information, but also creating a time limit to that is very critical. In this, a couple things that the CDC does mention that I thought would be beneficial to highlight is that stress during an infectious disease outbreak can include things like fear and anxiety, as I mentioned, but also changes in sleep activity as well as eating patterns and difficulty concentrating. And with some people that have mental health issues, it can also worsen this. So it's always a good idea to check in on your loved ones regardless of their chronic medical conditions, but also for people who may be dealing with other typical types of stressors like depression and anxiety. Also during this time, it is important to realize that some people may have an increase in the amount of tobacco use as well as drugs and alcohol. So everyone responds differently in various aspects of stress. So your background and the community in which you live also has a bearing sometimes in how you decide to react. So those that are high risk for severe illness from COVID-19, you also want to pay attention to elderly folks that are above the age of 65 that have chronic medical conditions like type 2 diabetes, for example, hypertension, and also different aspects of mental health like we talked about before. Also, children and teens and physicians and first responders and those with various aspects of respiratory illnesses are people that are more at high risk. A couple of other things that I wanted to point out, because oftentimes when you're speaking to someone who does know a lot about what's going on, it can help eliminate a lot of the stressors as well. So being well informed can also help decrease the amount of stress that people are undergoing. So a couple of tidbits and facts from the CDC. One fact is that diseases can make anyone sick regardless of ethnicity or their race. Fact two, most people, in terms of the immediate risk of something like COVID-19, are really having a low impact. Older adults, like I mentioned from before, and people of any age that have different medical conditions that can be considered high risk. And fact three, someone who has completed quarantine or has been released from isolation does not pose a threat or a risk of infection to other people. I know that some people, after they go through quarantine and they come out, it's almost like they're stigmatized and they don't know how to really reassimilate back, because people assume that if they've had it, that they can then reinfect. But this is something that you should be informed of, that for more up-to-date information, you can definitely visit the CDC's website. But in general, those people don't pose a threat. Fact four, there are simple things that you can do to keep yourself healthy. And number one, wash your hands. So wash your hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing, sneezing, and going to the bathroom before and after preparing food. When in public, you do want to wear a cloth mask and a covering that covers your nose and your mouth. I'm not in any vicinity with anyone right now at 6 feet away, so don't worry about me. You want to also avoid touching your eyes, nose, and mouth with unwashed hands. And stay home when you're sick. You definitely don't want to expose more people when you could be actually causing other people to get ill yourself. Fact 5 is you can help stop COVID by knowing the signs and symptoms. So fever, cough, shortness of breath. Also making for sure that you contact a medical professional if you do have trouble breathing or if you have any insight into any other person that could be at high risk. So for more information, like I said, visit the CDC's website, but most of all, stay safe, stay at home if you can, and if you have any information or any concerns about anyone that could be at risk, you want to contact the primary care physician. Thank you.